I qualified several years ago, and I became a doctor in the year 1989. I became a specialist in 1999, but I specialized in blood chemistry, which is chemical pathology. Thereafter, I ventured into so many things. I went for retraining on nuclear medicine, which is management of some diseases using radiopharmaceuticals or radioactive substances. Then I met my friend, Reverend Tony Akinyemi, about 23 years ago, who actually introduced me to what I would call alternative care practice. And I tried some of the things he was telling me, and thereafter I became a convert. And for about 15 years now, I've integrated alternative care into my practice, and my patients have benefited a lot from this. So it's part of those knowledge that I'll be sharing in my slides presentation, especially how to prevent fibroid if you don't have it already, and if you do have it, how you can then control it. Can I have the next slide? Now, uterine fibroid is a benign growth in the uterus of a woman in the reproductive age group. What that means is that if you are beyond the reproductive age group, or you are very young, it's unlikely you will have fibroid. So fibroid is a growth that is usually common in women who are within, let's say, from 18 to about 40, 42. Now, this growth is controlled by two principal mechanisms. It's both hormonal, in other words, the feminine hormone, like estrogen, progesterone, LH, FSH, all fuel the growth of the fibroid in the uterus of a woman. And the other part that many people are not conversant with is the inflammatory aspect. It's like the womb is reacting to something. Some people say maybe inability to nurture a child, or maybe because it's not yet time, or maybe because there is failure of conception. So the womb is trying to mimic carrying a baby. So those two pathways are already known to cause the growth of fibroid. Now the remedy, therefore, if we're going to stop it or prevent its further growth, we will have to hinge it around those two controls, which is quite hormonal, and of course the inflammatory pathway. Can I have next slide? So what are the preventive measures that we can employ in causing fibroid to shrink or not to grow if it has already started growing? I think the first one, which is probably one of the most important ways, is to balance your sex hormones. So we're talking about progesterone, which is what is produced from your ovaries in a cyclical fashion. The progesterone comes from the remains of your ovaries, of your egg, after it has failed to fertilize, or even when fertilization has occurred, the corpus luteum, which is the remains of the egg that has been released, continues to produce progesterone. LH and FSH are also, the precursor hormones that prepare your ovary to release the egg on a cycle basis, that is each month. These two hormones, LH and FSH, will begin to elaborate or increase in levels to prepare your ovaries to release their egg. So we need to balance this hormone, but the most important one is the estrogen. And what we have discovered over time is that if you are prone to taking a lot of animal proteins, your chicken, your eggs, all these animal products, we discover that your estrogen level is slightly higher than if you are if you are on plant proteins, like your legumes, like your beans, like most of the plant products. which actually also contain as much protein as the animal counterparts that we're used to. So my first advice, therefore, will be to limit the amount of consumption of animal protein if you already have fibroids. Now, if you limit it and you lean more on plant protein, you will limit the growth of the fibroid because your estrogen level will, plateau, and that will not encourage a further increase in the growth of the fibroid. But the more we take, animal protein, especially the processed one. Now, in Nigeria, we're able to raise chicken in our farms, in our compounds. But most of what is taken outside this, environment are things that are raised in, farms where they're sedentary, they're pumped with hormones, and these hormones, once we take them, they become, estrogens. They are processed to become, estrogens in our body, and they also increase our estrogen level. So we must balance what we take from animal products so that we can actually reduce our level of estrogen. Now, the second control, which is to control the inflammatory products, is by eating foods that promote or resist inflammation. Now, one of those foods is omega-3 fatty acids. Omega-3 fatty acids are known to be inflammatory dowsers. Now, because once your body enters into the inflammatory mode, some inflammatory cytokines are produced. Now, when you consume a lot of omega-3 fatty acids, which sometimes is controversial, but I have found that omega-3 fatty acids, when you take them from chia seeds, they are very useful, and they reduce the level of inflammation. They produce anti-inflammatory cytokines that dampens the process of inflammation. And that makes your body and the growth of the fibroid to be tamed. So you must be careful that part of your supplemental intake will include omega-3 fatty acids. Okay. Now you need to also boost your immunity, because it's your immune system that actually either support or allows insult coming into our body to progress or to recede. So if you process or program your immune system to be able to, fight this, you will do well. Your fibroid will be controlled, and the bleeding will also be minimized, even if you have a fibroid, because your immune system can then circulate or circle around it and begin to ingest it bit by bit. However, I must warn that the bigger the fibroid, the weaker the activity of the immune system in degrading the fibroid. And again, I must say that your immunity is helped when you lean more on the plant aspect of habits or feeding, rather than the processed food that is consumed outside this environment. Now, I will not talk about supplement today. Maybe subsequently we'll talk about that. Now, the next thing that I would like to pick up on this slide is to oxygenate your body. Now, fibroid has been known to grow more in people that are outside their normal body weight, their normal body basal metabolic index, which is your weight in kilogram divided by your height squared. If you are less than 25, actually up to from 18.5 to 24.9, you are good. But anything from 25 and above, you are overweight. And the more overweight you are, or you are growing towards obesity, the more fibroid tends to grow in such individual. However, we are seeing very lean people with huge fibroid. So that means there are other factors that may, produce fibroid in them. So what I was about to say is that you must exercise as a way of lifestyle, at least 4 to 5 times in a week. And this must be brisk exercise like walking, and it must make you to sweat so that you can lose some of the salt that has been contained in the processed food that you are eating. If you do this 4 to 5 times a week, you are good. The other thing it does is that it oxygenates your body. So exercise is very important. I think the next process here is to alkalinize your body. Fibroid tends to grow in an acidic environment. And this acidic environment is conducive for its growth. And how do we produce this acid? When we take a lot of animal proteins, it accumulates acids in the body because their metabolism tends to produce acids or hydrogen ions. Hydrogen ions will make our body to go acidic. So how do we alkalinize our body? How do we make our body slightly alkaline, making your pH to increase rather than fall? The lower your pH, the more acidic it is, and the higher your pH, the more alkaline it is. So one of the things that you can do is to use apple cider vinegar, which if you get the organic type, all you need is a tablespoon or two in a glass of water, preferably warm water, first thing in the morning. Once you do that, if it is processed in your body, it becomes alkaline, and that alkaline nature recedes the growth of fibroids. It helps the immune system to be able to work on the fibroid, and the inflammatory processes will also be dampened. So bleeding will not be as much, unlike a person who has an acidic body environment. Now, people also say we can use baking soda with blackstrap molasses for better result. But if all you can do is just to put a tablespoon of apple cider vinegar in a glass of warm water, you are good. Let me show you another one. Next slide. Now, I've said this. Another very easy way, if you don't have apple cider vinegar, is lemon juice first thing in the morning in 1 glass of water. Now, just a half of, I know some lemons can be big, but just about a third of a whole lemon, you squeeze it into a glass of water, also will make your body to be slightly alkaline and not acidic. Next. And it also produces the process of removing toxin. Now, let me talk about detoxification a little bit before I come to this juice. Why do we need to detox? Actually, when we take our food, the residue, the longer they stay in our colon, the more the unwanted end product of metabolism are, imbibed or ingested into our body. If the body does not remove them within 24, 48 hours, they get incorporated into, our body milieu. So detox or removing this unwanted, end product of metabolism is very important. If not every day, at least every other day. And detox tends to push out all these xenobiotics, things that we have ingested that are artificial, that are not useful to our body, and which are usually pro-inflammatory. So when you detox, you are removing the things that support inflammation. And inflammation, like we have mentioned, will cause fibroids to grow. So we want to get rid of them. Now, this is a simple juice, which is very appetizing as it looks. All it requires is a glass of water, just your usual glass. Now put 2 tablespoonfuls of apple cider vinegar, 2 tablespoonfuls of lemon juice. So it's like we are combining several detox methods into this glass of detox juice. And then, of course, 1 tablespoon of cinnamon. If you have cinnamon, that's you ground it and it's very fine. And then 1 tablespoonful of raw honey. I'm talking about the real honey. Now you blend all this together and then you take it again first thing in the morning. Now this will not only make you to detox, it also causes weight loss. So this is a 2-in-1 juice. It causes you to lose weight if you take it almost every day. By the time you will have taken this for a month, there will be significant loss of weight. That you will notice, especially belly fat and fats in the flanks that where it normally will gather for the women. Let's go on. Now, I told you that fibroid is a growth, but it's a benign growth. Now, that is in contradistinction to what we call a cancerous growth. A cancerous growth, the property is that it's able to leave the primary area where it started from and it goes into other parts of the body. That is, it metastasizes. But this tumor is usually confined to when it is benign, to where it is. That is in the uterus in the case of fibroid. So what can we do? We can use anti-tumor agents such as digesting enzymes. Now, two are very common. There is this one that we call papain, which is in pawpaw, and we have bromelain in pineapple. So if you take this, again, raw, first thing in the morning, 30 minutes before your meal, you are releasing these proteolytic enzymes. Now to begin to work in your body and break down the fibroid. If you are consistent with this, definitely the fibroid will not grow, but it will regress. Another one which we have known works is energy iodine. Now this tablet, the way it does its thing is that it's also able to shrink the tumor. So you can take the prescription that is there, about 12.5 milligrams once or twice a day. It shrinks the tumor and makes your fibroid not to continue to grow. There are hormone essential and fibroid shrink. If you need it, these are already available commercially and you can look for it. So we've talked about detox, we talk about anti-tumor. We have talked about things that will fight the fibroid itself. Another thing that is very useful is your turmeric or curcumin. Now what it does is that it's again an anti-inflammation agent, okay? And when you take this turmeric, if it is turmeric powder, you can mix a teaspoon of turmeric in your breakfast smoothie. If you are the type that will take maybe cucumber smoothie with strawberry or whatever smoothie you like, you can just add a teaspoon of turmeric to it, and you're already causing a decrease of inflammation, and it shrinks the tumor even as you continue. The level in your body will encourage the shrinking of this tumor. Another thing you can do is to add a teaspoon of turmeric powder to hot water in your teacup and a teaspoon of coconut oil and a little honey to sweeten. Again, we're talking about anti-tumor agents. These are things that will shrink the tumor and will not allow it to enlarge. So from detox to exercise to shrinking the tumor, if you practice these three, you will discover that you can actually control the fibroid, especially if you don't want surgery and if it is not too big. If it's not too big, all this procedure will make the fibroid to disappear with time. Next slide. Now, I'm coming to some of the things that are pro-inflammatory. These are the things that will cause the fibroid to grow very well. Fried foods. I know we all love fried things, fried plantain, fried yam, but you can put this in electric oven. You can make your plantain to be like boli. You can fry it, you can roast your yam and you can roast your potato rather than fry them. And I know there are so many gadgets today that will not use oil and will still get and give you the taste of these things fried. Rather, not fried, but you have the same taste rather than the fried component. When you fry, you turn your oil from the cis isomer to trans isomer. And this trans isomer state actually encourages inflammation. Your body is unable to recognize it as normal, and so it becomes aberrant. The body cannot attack it because it is strange. So all fried foods must be eliminated. Indomie, noodles, spaghetti, macaroni, because of the way they are prepared. These are largely foods that are what we call low calories. They are low fiber diets. Low fiber diets stay long in the body. Therefore, whatever is used to prepare them will escape into your body system. But when you take complex carbohydrates with huge quantity of fiber, you are able to eliminate them within 24 hours. So when you take all this, it encourages nasty chemicals to stay in your body, and all this work by promoting inflammation. MSG, monkeys and orange, please, if you can do away with them, great. But if not, very, very small use, make it not to be noticeable in your diet. Otherwise, you'll be increasing inflammation. Sugar, soft drink, packaged juices, all this must be removed. If you want to take juices, you must prepare it yourself. Okay, the way a whole fruit is juiced, and you take the benefit of not only the sweetened part, but even the nutrients that are in the cover. They go into your body and they can help you to, remove toxins. Sugar, white flour, bread, biscuit, all this must be removed. Yes, please. Next. Wheat product. I know we all like bread, but if you're going to take bread, take a whole wheat bread, right? Prepare it and don't let it be every day. I know that in overseas, your country over there, because of the time, you don't have time to take things that are not processed. But if you have to fight this fibroid particularly, please avoid it if possible. Cow milk. No, there are so many alternatives to milk. You can make milk from coconut. You can make milk from almond milk. And I know that you have such varieties over there. So rather go for coconut milk or almond milk rather than cow milk. Cheese, ice cream, chocolate, because they give you extra calories. These sugars that you take will add to the adiposity of the body, and all these are, things that encourage fibroid to grow. Because it is tumor, it also feeds on glucose. So the more you reduce your simple sugars to complex sugars or complex carbohydrates, the better for you. Refined or table salt. Rather, you should use sea salt. If you haven't changed to sea salt has the advantage that apart from sodium and chlorine in the salt, it has 48 or more other nutrients that are good for your body. Avoid caffeine, coffee, Lipton, Bournvita, Milo, Ovaltine. And the question is, what do I take? You can take green tea, and you can take green tea as many times as you like. You can take Lipton, with a little teaspoon of honey. But if you can do it without, the better. Remove artificial sweetener, saccharin, aspartame, sans, creams, soda. All of this must go. And I know you can do all things through Christ that strengthens you. Now, all these are difficult, but they are doable. I must round up by saying that I appreciate my friend, Reverend Tony Akiyemi, who actually is my own life coach when it comes to alternative means of taking care of our health. I integrated his approach, and my patient has been getting much better. And I must also appreciate the convener of this program, Madam Tony Taiwo, for starting this network and for inviting me. I'll be glad to take any questions thereafter and subsequently. Thank you very much. I hope I've been able to communicate something.
Thank you very much.
Thank you so much, Dr. Adedapo. I think even for me, that was educative. I think it just means that I'm just not going to eat anymore, because at this point, there's nothing else on that list. That's it. I'm just going to drink water and mind my business, and maybe I'll be all right. But yeah, that was very informative, very, very, very informative. While we still have you on here, we're going to do a short quiz. But before I get into this lovely short health quiz, has anyone got any questions for Doctor while we still have him here? You can raise your hand or you can put it in the chat. Yeah, that's what everyone is saying, Doctor. They're saying basically we can't eat any food. That's just it.
I must say complex carbohydrate is very important. Now, simple sugars, processed carbohydrates are not going to help because they're going to send loose calories into your body.
Okay.
And this is just going to inflame the fibroid and give it the power to grow more. And that's why probably people continue to bleed, because the fibroid is growing as you are giving him the necessary nutrients for it to continue to perpetuate itself. So you must take the bulls by the horn, actually to eliminate, if not, limit their intake. Okay, go for complex. You can still eat your eba, you can still eat your... Yes, please. I don't know.
Do you
if you are here,
do you have a healthy recipe for jollof rice that you could send us? So that maybe have you got like any recipes? Because I use Maggi quite a lot. I kind of like Maggi. I mean, I have an air fryer, so no problem. I can cut the fry through. But like Indomie, the kids love Indomie. It's just easy, But if you're saying no, then
it's not only for now. Actually, Indomie contains a lot of MSG, that's monosodium glutamate, and it has been discovered that this compound is also neuroexcitatory. And a lot of people are also beginning to link it.
What you said? Can you simplify that? It's neuro what? Enough for just
excitatory. It causes the excitation of the membranes of the brain, and the effect of these things will come later. Later they will have a lot of neurological issues, which will culminate in cardiovascular diseases, some neurological problems that will be difficult to treat, because it's as a result of accumulation of several years intake of this compound. And the better they are, you take them off, or you use them very sparingly. Now, if you use the sea salt that we prescribe, that we are suggesting, it will take care of a lot of things, because apart from sodium, it has iodine, it has magnesium, it has potassium, it has several things that we need for neurocognitory functions, which is what we are suggesting. Limit as much as possible the usage of whatever contains monosodium glutamate. Now, if you said they love Indomie, why don't you order some of other rice and see whether they will like it? Because we discovered that it's complex. The processed rice that is consumed over there is very fine. It's one of the refined carbohydrates that we mentioned. And I don't know. It's important to move our bowels at least once or twice a day. But if they still take those meals and they are emptying their bowel once or twice a day, I'm happy, because it means that whatever they consume does not stay more than 24 hours in their system. But what we discover is that constipation is often and is usual and is the way of life of people who consume all this food. They don't move their bowels much. But if you consume a lot of vegetables, your diced carrots, your diced lettuce, your diced cucumber, and you take a lot of fruits, you can ameliorate or mitigate the effect of consumption of those food. But it's better to take the children off and not make them used to it while they're growing.
I think we'll say if we slowly just start to transition.
Exactly.
So we start off with maybe no meat and maybe fruit, and then we slowly get there. Then we'll find a way to make jollof rice with no Maggi, and then we'll slowly just we'll get there.
Yes.
So it's not going to happen overnight. It's going to take us some time.
No, most likely not. Yes.
That's good. Well, thank you.
And being intentional as well. We have to be intentional about making the changes.
Yeah.
Amen.
Yeah, I agree.
That as well. Any more questions from anybody?
Yes, I have a question. Thank you so much
go ahead.
for the support network on. Really appreciate it. Like yourself, Toyin, I looked everywhere for support. I've been struggling for over 10 years. I'm like the woman with the issue of blood. And I feel just like the rest of you probably quite qualified to be on this network today, running my personal experiences with this. Dr. Adedapo, thank you very much for your presentation, very informative. A lot of it, on my 12-year plus journey with fibroids, I've learned a lot about this. And obviously nutrition is subject to the person's condition, so it's not like one size fits all, even though you've got a very comprehensive plan out there in order for those to follow. My question to you mentioned something about hormones being one of the factors that can increase the impact of fibroids, and from my research over the years I know that's true. You also mentioned that certain foods can enhance hormones, but you didn't mention anything about drug interactions with regards to those that are on certain medications with potentially the foods that you have suggested. Right now I'm on norepinephrine, which I'm not sure if you know what norepinephrine is. It's obviously a progesterone to stop heavy bleeding. I'm wondering what would the impact be with regards to norepinephrine and its impact on number one, fibroid growth, and possible interactions with the comprehensive diet plan that you've put out there. Thank you. So hopefully you heard my question.
Yeah, I could pick part of it. You talked about the interaction of some medications with the hormones. That's quite possible. And we know a lot of interactions do occur, when people take certain drugs. But more importantly to me, you need to find out if you are on any drug and it's aggravating, the fibroid, or is making it get bigger, or the bleeding is more. Now, what I was saying when I was talking about, controlling the levels of the hormones, is to say that if you make your diet to consist of maybe 40% fruit and vegetables, and 60% the usual food we're used to, you're probably going to lower still the level of your estrogen than when 80% of your food is this synthetic or synthesized or industry produced food, rather than taking our food in the native environment when God made them. And I'm sure that vegetarians, if we do a comparative study between vegetarians and non-vegetarians, fibroids is much less common among them. I may not be able to talk about all the drugs that may affect or cause our feminine hormones to be elaborated, but certainly if they are prescribed by a doctor, or even if you take the leaflet, there will be some remarks about what they do and what they interact with. All I'm trying to say is that it is known that if we are high on animal fat or animal proteins, this hormone level will be much elaborated, and it will, the progression of fibroid from the little it started from to the huge one that bleeds a lot will be faster than if you are on, vegetables, components. And I'm advocating by this presentation that we should actually incorporate a lot of fruit and vegetables, and let it be organic, not the GMO produced one. The organic one are more beneficial to our food. I can tell you a joke. When I first visited America many years ago, and I saw the GMO black pepper, green peppers, red pepper, I fell in love with them. I said, wow, look at them. Then my friend quickly pointed my attention that these are not natural ones, these are not the organic ones. And these are the ones that are more appealing. So we are lucky here that we still don't have GMO as much. And I want to encourage, when you go shopping, go for the organic one and consume them much more than the GMO variety, if you ever do.
Perfect, thank you. Thank you so much. I hope that answered your question, Alicia. And I think we had Nita that had a question. Nita? Have we got you still? No? Okay, that's fine.
My question has been answered.
Okay, perfect. Is there anyone else that has any questions?
Yep.
Before we go on to my lovely health quiz that I found on YouTube, or Google rather, any other questions for anybody?
Yeah, I have a question.
Yeah, go ahead.
So, Doctor, over here in the UK, it's quite common for our practitioners to kind of prescribe us with hormonal birth controls. Can you kindly give us your advice in terms of if someone has fibroids, which kind of contraception they should try and stay away from?
Well, maybe I'm not competent to do that because I haven't studied largely what obtains in all these pills. And I'm sure some of the speakers here may be able to answer that question better. There are some gynecologists who will be coming to speak, but I would rather I think any of those formulations that are high in estrogen, rather than progesterones are not as problematic as the estrogen accentuated type. So if you already have fibroids, I think you should be aware that estrogen will continue to fuel the growth. And in that wise, you may want to consider an alternative method of contraception rather than go on the pills.
Okay. Did that answer your question, Esther, a little bit?
No, it answered it perfectly. Thank you so much.
Perfect, perfect. Does anybody else have any more questions before we move on? Okay, so don't all rush at once. I'm just going to do a quick health quiz to see where we're all at, make sure we're all awake and we're listening. So my first question is, what is the... Wait, let me show my video so you guys see my face. Okay. What is the best thing to drink to keep you hydrated? Anybody? Don't all rush at once.
Water.
Water.
Yeah.
Water.
Y'all getting it? You're getting it? Nice.
H2O.
Okay, lovely. Okay, next question. What is another name for the vitamin B3? Don't all rush. It's okay. Let me check the chat. No? Nobody? Even a guess? A guess, maybe? Okay, let me not lie. I didn't know the answer to this question either. But the answer is niacin. Oh, yeah. Okay, Jocko, UK. Yeah. Okay. Cool. Next question. These are all kind of related to what Doctor was speaking about. What foods are major sources of vitamin D? Let's have a look.
Sunlight. It is a food or
Foods. What foods are major sources of vitamin D? Yeah, milk is one. Cheese isn't. Well, it's not on here. Oily fish, yes. And this other one, I'm not sure if anyone will even get it because I wouldn't get it. Yeah, eggs. Yeah. Yeah.
red meat.
Oh, apparently not.
Yeah,
Okay.
there is egg yolk.
Liver.
Liver,
Yeah.
egg.
Okay.
Peanuts.
Well, here, Doctor, please correct me if this is wrong. It says fortified margarine. Is that correct?
Okay, come again.
Fortified margarine.
Yes, it contains vitamin D, but it's not the best source.
Okay, so let's not even take this in, guys, because this may not be accurate. Okay, the next question is, what does holistic mean in reference to holistic medicine?
Holistic has to do with total, everything.
Spot on. So the example is addressing the whole person. Okay, what is another name for vitamin C?
Ascorbic acid.
Oh,
Should I really be answering? Maybe I shouldn't.
you're good, because I was like, okay. What spice helps with nausea and motion sickness? Oh, I know this
Ginger.
one. Yeah.
Ginger.
Yep, know that one all too well.
No, I didn't get that. What's the answer?
Ginger.
Oh, ginger. Okay, all right, thanks.
Okay, so citrus fruits are a great source of which vitamin?
C.
Sorry?
Vitamin C.
Vitamin C.
Perfect. Okay, next question. What is the most common contaminant found in fish?
Mercury.
Mercury.
You people are really smart. Wow. Okay.
That's perfect.
So I don't know any of these. What is the scientific study of human movement?
Kinesiology.
This is lovely. You guys are really, really good. Okay, and the last one, last but not least, stretching after a workout helps to accomplish. Stretching after a workout helps to accomplish.
You're breaking off.
We didn't hear you, Dee.
This is frozen.
Oh, yeah.
Let it go, let it go.
Even though I haven't heard the question, I know the answer. No, it's only because I'm getting expo from someone who's very knowledgeable.
Because I think she's
Okay, I think this frozen. Okay, we need to go to the next one.
Can I ask a question, please?
Okay, quickly. One last question, and then
I
that's it. We
think
need to move on.
I typed the question here. It wasn't answered.
Apologies.
Yeah. I said, could fibroid be hereditary? You know, when you go to your doctor, they ask you, what's your history? Even though it's benign, you know, could it be hereditary?
Dr. Adedapo. Okay, let's hold on to that question. We'll ask it again when the gynecologist come to share with us.
Let me say.
Okay, sir.
That it could be, but it's not defined. It's not defined as to the heredity of fibroid. But you see, what happens is this: if you eat the same way your parents and your forebears have been eating, you are likely to also come down with the diseases that they've been, facing. So, but if you change your diet appropriately and your lifestyle, and it's known that when people change their environment, the kind of things that their forebears have suffered may not likely be. I hope you got what I'm saying.
Sorry, is it possible for me to chip in something?
Yes, go on, Nneka, quickly. Nneka's a GP. Are you a GP? Yes.
Yes, I'm a GP.
Go on, Nneka.
I'm GP, but I can say, like, in my family, we're 6 girls, and almost all of us have fibroid. So there may be a possibility, like Dr. Gynecologist said, of possibility of hereditary.
The same with me. My mum, my grandma, my mum's sister, and myself all have fibroids.
Okay,
We
well,
all live in the same environment and all eating the same way. What was passed down from parents, that's the way you live, that's the way you are in the same environment. So that may explain that heredity will be very low. In fact, if somebody has a gene that codes for cancer, if you change your lifestyle, about 70% of genes that are inherited do not express spontaneously. They are only, triggered by the food that we eat. If you supply the trigger element, then they will express. And it will seem as if, heredity is working here.
okay. No worries. Thank you so much.